place to be is living free in Tennessee.
Welcome to the Living Free podcast, where we are doing our best to break out of the system, choose freedom, and build a better world together. I'm Nicole Sauce. Now, some of you are witnessing at this moment the birth of a new podcast. And if you listen to my other podcast, Living Free in Tennessee, this will just come out on that show. But we are launching the Tuesday discussions as a standalone podcast in 2025 called the Living Free Podcast. And I'm excited to have an episode today that's not an interview. We are not that I hate doing interviews, but I had an interview queued up today, but I hadn't heard from the person that the date and time really works. So I decided once a month I am doing some thoughts on freedom and things that break down in our society and ways we can overcome that. And I thought today's that day. And I've had something on my mind all week long last week and into this week that I kept thinking, like, what should I talk about? What should I talk about? I'm like, I know what I should talk about. So once a month on the Living Free podcast, we're going to go unplugged. Today is that day. And I'm going to talk about the U.S. healthcare system and its impact on our freedom, because you can't have a healthcare system like ours and just ignore it if you're building the life that you want to live, right? So for those of you on the live stream, do me a favor. If you have a question or comment today, put question or comment in all caps and then ask your question or comment. This is something where I'm throwing it out there and your job is to throw it back at me so we can find a solution together, because that's how we build a better world together. It's by finding those solutions, finding ways around the barriers that are thrown in front of us by the system we live in, breaking through the programming that has happened just by living in our society. We are programmed to react. I see it very starkly in the reaction to the LA fires, where people who I know are freedom-loving individuals are like, yeah, but that doesn't matter because those people were rich. And so we don't need to help them. I'm like, yeah, we do. Losing everything is losing everything. And we need to bring the same moral impetus into a situation like what's happening in LA as a situation like what's happened in North Carolina. And both areas need help. And both areas have rich and poor people. There may have been more rich people in LA. I don't know. I haven't looked at the data. So that's my assumption. But that doesn't matter. There's still people who lived paycheck to paycheck. There was somebody there about to lose their home that saw it burn up. There were instances of insurance being canceled before the fires happened, like all of it. And it's not fun. Anyway, so if we're going to build a better world together, we need to build it for everybody as best we can. And we should stay consistent. Before I jump into our discussion today, I want to talk about our featured event for today. And that is the Self-Reliance Festival. Save the date. This is your save the date announcement. Apparently, it hasn't been obvious to people that Self-Reliance Festival is October 4th and 5th. We're going down to once a year, October 4th and 5th. And we will be in Camden, Tennessee again. So that's the region that you're looking at. And I will be launching tickets probably next month. There may be like a sneak peek early adopter thing that happens between now and the end of the month. I wanted to be really clear with the team who helps me make this event fantastic, what we're doing, how we're doing it, before I really launched, so that we would not have, a scramble. It's kind of like I talked about yesterday, right? First, you have to slow down to speed up, that sort of thing. So save that date, October 4th and 5th for the Self-Reliance Festival. Also, I want to thank our second sponsor, our first sponsor of today's show. Sorry, not our second sponsor. I will thank our second sponsor after I thank the first sponsor. And I figured for a Tuesday coffee chat, we should just go with, the lighting is not good, hollowroast.com. That's my mug, right? Oh, here we go. See that? Isn't that a beautiful red insulated mug? And you know what's in my mug is Hollow Roast coffee and the last of the heavy cream from my half gallon of raw milk that I got this week. And that's not the end of the world, because later today, my half gallon of raw milk comes. So it lasted just long enough for me to get this cup of coffee for today's show. So Hollow roasts orders to order, and we roast about every other day and then ship them out as best we can. And the reason we do that is so you have the freshest coffee you can have delivered to your door in the mail at hollowroast.com. Check it out. And Margot says, I have a fresh cup of Dark Horse. That's one of our coffees at hollowroast.com. Cheers, Margot. Good to see you on today. Our second sponsor of today's show is Above Phone. And I thought, what better sponsor to have on a freedom-oriented phone than our phone show than Above Phone? Above Phone, here's their tagline, right? Replace big tech with your private ecosystem. This is a way to regain control of the things that your iPhone and your Android have taken away from you, where your data is what's being monetized on the phone. You get to choose what you have on the phone. And if you want to have a tracking app like Facebook tracks you, right? You can put it in its own little vault on your phone to use that app. Check it out at abovephone.com. If you use the link in the show notes at livingfreeintennessee.com, they will know that I sent you. But I also have a coupon code for you. So if you decide to go for an Above Phone, you can get $50 off with the coupon code LiveFreeTN. That's LiveFreeTN. Check it out at abovephone.com. And now on to the main topic of today's show. We don't have segments. We don't have any of that Monday stuff, guys. It's just about healthcare today. And it starts with the question, and this is what I've just been thinking about as the year progresses, and I have been navigating some health issues that I think can be handled with diet, exercise, nutrition, sleep, all of the things we should do well. That's why, I mean, when I read Outlive a year ago, it was really helpful. I'm reading a book called Good Energy now, same sort of idea. And I'm starting the Carnivore Challenge next week, the paid coaching program. It's $99. And that program, I guess I don't have a link in the show notes at all. I'll throw one in the show notes after this, but on YouTube, guys, you don't have a link to that. That one is something I decided to do because I know eating carnivore makes me feel good, but I sometimes have a hard time sticking to it. And I'm going to give it 8 weeks and see what health benefits I have. And when they ask me my goals, like they start out saying, what are your goals? And I was like, well, my goals are not to lose weight. It's actually just to feel better. That's it. It's that simple. And pretty much since I was sick in August, I haven't been all the way right, which is not a big deal, but it does have me thinking about healthcare. And as a solopreneur, you go into this world and you ask yourself, what are my options for healthcare? In fact, one of my neighbors came over who is suddenly a independent contractor instead of an employee and said, what are my options for health insurance? And I was like, oh, that's a great question. I have whole shows on that. And that hasn't really changed. The only thing that's really changed since I started talking about your health insurance options on the podcast are that the fine for not having health insurance isn't really being enforced anymore. So you don't necessarily have to have a plan. And because of that, some emergency plans and other things have come up that people are using that they didn't used to be able to use. But that's the question I do get very, very often when people are looking to transition out of a life as a job conveyor belt person or a job slave to working for themselves, because a lot of people see their path towards freedom, independence, and liberty to also mean taking responsibility for their financial health and not being subject to the whims of an employer. They become the employer. That life isn't for everybody. I know people building lives of freedom who just earn a boat ton of money at their job in, the multiple six figures and have been really good about not outliving their budget. And they're just independently wealthy at this point. They figured out how to invest. That's another path, right? What we're exploring on this podcast is different pathways towards freedom. And that can be anything. It can be my friend Sue in New York in her smaller apartment than my house, probably. Or it can be somebody homesteading like I am. There's lots of different ways to build liberty into your life and to take control of the things that you can control, because nobody can control everything, right? So one of the biggest reasons I was given way back when Obamacare passed for why we needed it from a friend who I often they come at things from the left-leaning perspective and I'm more from the libertarian perspective. He said that health insurance was necessary because as an aspiring entrepreneur, you're already facing a really tough road ahead. A lot of people start a business and they fold, and then you get sick and you lose everything. You lose your house, like everything, and you might even lose your life because you didn't have enough money to pay for it, or you have this credit thing hanging over your head for the rest of your life. And health insurance is also prohibitively expensive. And this is like a perspective back in 2012 we're talking about, right? So this was a while ago when I wish I could get the premiums of 2012 today in 2025. And note that I don't refer to this as health care. I refer to it as health insurance. And that's with a reason. I remember ending that conversation by pointing out that he and I wanted the same thing because we had just a habit of having these like really wild debates. We both enjoyed it. We both had our reasons. It was like head to head, blah, 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 right? And nobody wins. And we'd go on for hours. And about, I don't know, 10 minutes into the conversation, I'm like, we want the same thing. We want the people who need the care to get the care. We want it to be affordable and not to bankrupt them. And we just want to get there different ways. You want it through this Obamacare system, which was built on top of policies that have been put in years before, some of them under Ronald Reagan. So take a look at that history if you're very interested in that, because Obamacare wasn't like out of left field. It was building on an already completely broken system that goes back a very, very long time, right? And it's important to remember that because every time we try to build on top of something that's already broken, I haven't seen one thing stand up to the test of time that we build on an already broken system. And that's part of what we have is we have this legacy culture, habit, system that we've accepted as this is the only way it can be. And you and I both know that's not true. And when we talk about breaking out of the system, that's what I'm talking about is letting go of the perception is it has to be this way because it's built that way. That's how we have a hard time getting people to embrace permaculture, right? It's like, well, we've always tilled the soil, so we have to till the soil. You don't have to till the soil. Spoiler alert, right? Margot's saying 900 pages in Obamacare. Yeah, there were a lot of carve outs, and some of them will work in your favor, those carve outs, as you move forward and take ownership for your health care, not just your health insurance situation. But when I pointed out to him that we wanted the same thing, it was the last time I had a crazy debate with him. Like, we've had a few discussions about this or that fact. We've talked about, all sorts of different policy things, but that was the last time it was really adversarial because he was like, oh, it's not that you just want capitalists to win. It's that you think that's the better way for them to get care, wherein I think the government should pay for it, right? So following that, and not long after that, so 2012-ish era, a friend of mine was in Great Britain and she got in a car crash. And it took a few weeks for her to get flown back to the US. And in Great Britain, they have a more socialized health system than here. That may no longer be the truth, but I think it's kind of the truth still right now. I haven't done a deep dive into the British healthcare system ever, but I haven't even looked at it in a perfunctory way in the last couple of years. I do know that our health care system is more fascist than socialized, but it's kind of like those two things are different sides of the same coin, right? And we are more fascist than we were. So while she was at the hospital in Britain, they had no idea how to get paid for giving her care. Like, they didn't let her die, but they didn't know how to get paid. And so she had an advocate fighting for every step of her care until she was well enough that she could be flown back out of the country. Now, I'm going to assume she did not have travel insurance, which you can buy a rider where they just figure that out. I don't know how that works in Britain, but I know that it's not a bad idea to have that kind of an insurance policy if you're in another country, because you never know what your care will be for sure. And it's good to look at that if you're going to be traveling in another country, because your bus might go off a cliff, or you might be knifed on the subway, or who knows what could happen. You could just break your ankle walking up a path in Greece. Like, it could be completely innocuous, nonviolent. For her, it was a car accident, and she was at a hospital where they're like, yeah, we'd really like to patch you up, man. We're keeping you alive, but we don't know how to get paid for this. And she's like, well, why don't why don't you just give me the bill and I'll pay? I'll just pay you directly. And they had no idea what to do. They had no idea what to do. They couldn't figure out how to take her money or money from her family. And that was a really uncomfortable situation to be in. And it put her outcomes behind. Right. So she eventually flew back and got care here where her insurance worked and it was fine. But she had a much longer recovery path because that system didn't know how to take money for service. And that is quickly how our system has been going in the last decade, right? There are times where they just don't know how to take your money. And 6 months later, they're like, and you owe me for another thing. And you're like, and you owe me to death here. So in the early aughts, like 2002, I was working for myself. And at that time, we had these plans that Obamacare basically rendered illegal, which was you could have a high deductible insurance plan, so like $1,000 out of pocket a year, and then they'd kick in at 85% up to $3 million or 90% up to $3 million. There's always some percent up to some amount of dollars. They had in-network stuff. They had all these parameters, just like health insurance does, but it was more of a catastrophic thing. Like you pay your first $1,000 every year. And that means if you're going to go see the doctor and you have strep throat, then you're just paying for that. Right. But you could also put, I don't remember if it was the full amount of your deductible or up to 75% or something into a health savings account, which was a pre-tax benefit. So it came out of your income before your income was reported, which could move you down a tax bracket, which could mean they take a smaller percentage of your taxes, which then means you don't have to wear the tax slave t-shirt as long this year. And then you would have that money. And when you retired, if you still had money in your health savings account, it converted to retirement money, right? Which has all of the rules that the retirement money has. Like when you take it out, you have to pay taxes on it at that time. There are certain percentage of your retirement that you have to take out every year after you reach a certain age. Like there's all these rules, some of which I should learn better than I know them, to be completely transparent. So that was the policy of entrepreneurs, especially ones who were aspiring entrepreneurs like I was at that time, where I was just starting to work for myself for the first time. And so whenever I needed to get care, I would talk to the office manager before getting seen to negotiate my fee for that day. And I'd say, hey, man, if I pay cash today, which at that time meant write a check, right? Write a check or use a debit card, or rarely was it actual cash. How much will my bill be? And they would very often just knock off 25 to 40% of the bill, because they knew if they didn't have to pay the coding person to do the coding, to submit to insurance, to get denied, to resubmit to insurance, to get approved, to then send you the bill for what insurance didn't cover, which is what was already happening back then. That was a lot less overhead, and it was better to have cash now. Like having cash now for them, or having the money now for them without going through all of that, meant that they came out ahead, even though they were billing insurance companies for much higher amounts. So I would accept that offer. That's how I worked. And for anybody listening to this going, that's a lot, Nicole. It was a lot. The struggle is real. It's not fun to be able to have to negotiate your cost of care every time, knowing that they're screwing you every time going in with a high number. In fact, I hate haggling. I have traveled all over the world. I've gone to markets, and you're like, I want the sweater at the market. And they're like, it's $100. And you're like, I'll give you 20. And they're like, no, I couldn't possibly pay 20. How about 80? And you're like, 25 is my max. No. And then you walk away, and then they run down the street and sell it to you for $25. That's really fun for some people. To me, that's an enormous waste of time and boring. And so that was basically what I was forced to do for healthcare back in the aughts. And one of the reasons that health insurance companies who had to vie for your business because they were not required, one of the reasons they gave for using them is that they negotiated the rates for you and you didn't have to mess with it. But even at that time, the rates they negotiated were higher than the rates I could get by just being a person. So then I needed a specialist. And that specialist did a bunch of tests. And when that specialist did a bunch of tests, they didn't ask for my permission. And then they scheduled me for a biopsy, didn't tell me what they were looking for, took a biopsy, which disfigured me. They took more flesh out than they needed to. It was an unnecessary thing. I've had subsequent doctors going like, wow, they really mutilated you. And I was diagnosed with an autoimmune skin condition that doesn't usually happen to people at my age, in my 20s, right? And it's called lichen sclerosis. And it's something that they, to this day, don't really know how to treat. They're not good at treating it. I've worked with some specialists, some like functional medicine specialists that can make it go in remission or help me make it go in remission. And lifestyle choices have a big impact on it. But I got this disease or this autoimmune problem right around the time I also was getting the Hep B vaccination. And it would flare up every time I got that. And so it's a 3-shot series. I think it was a Hep C. I don't know. I was going to Thailand, so I was getting the hepatitis C vaccination. And after the second one, when it got really bad, I never took the third one. And I was not reported to VARS, and because they didn't think that was the thing. But I felt like if the timing is so close to that, perhaps that's not good for me. And then like my risk of getting Hep C because I'm not promiscuous was if I was in a crash and they happened to put, there was somebody else bled on me, or like the ways I would get it were not, I wasn't likely to get it, but I had never thought about that at that time. I was just like, no, you're going to another country. You don't want to get malaria. You don't want to get Hep C. You don't want, you know what I'm saying? Like vaccines up to date, all of that stuff. And when I went to negotiate the bill, I was like, what are all these other tests? They didn't even tell me they ran the tests. There was like all sorts of screenings for things I could have already told them I didn't have, like HIV. To have HIV, you have to be exposed to blood or have sex with somebody that has HIV. And again, not promiscuous. So I was like, no, really. Not only not promiscuous, but condoms are my birth control. I'm not on the pill for a reason, like, because that's also bad for you. So also not exposed to things from the one person that I was with. So, but doctors don't believe you in that situation. But we could have had that conversation and moved on. And it turned out, guys, I was HIV negative. I'm just going to share everything on the internet today. But she kept asking me, I was like, well, how much is this going to be? And she's like, I don't know what to charge you today because we have to do all the coding and then we have to bill your insurance. What's your insurance? I don't have insurance. I don't have insurance that you can bill. Like I have to bill it and I have a high deductible. And so I'm going to end up paying you. So I want to know what the price is. And she's like, well, just apply for this government assistance so that we can bill them and then we'll know what it's going to cost. She like literally had no idea how to take money from me that day. And months later, there was finally a bill for like $3,000 for very little. And then I called them and it was knocked down to, I offered them 60% cash and they took it and I paid it. And that knocked out my deductible and I got reimbursed above $1,000 at 85% at that time. Again, when you're sick, dealing with stuff like that's really hard. So I wasn't super sick. I just had some symptoms I didn't like. And even then, it was like a huge drama in my life. And that was an early sign that managed healthcare of the 90s had taken over this hospital system in Portland, Oregon, and made it already so it was hard to pay cash for service. And when you can't pay cash for service, you are no longer the customer. You know who the customer is? Your insurance company is the customer, and you're the product. And that equation is not a good place to be. You always want to be the customer. If you're not the customer, they don't have to make you happy. You're already in a situation where you're not happy. Margot's saying a few years ago, I tried to pay cash for some doctor stuff and they refused because I had insurance. They weren't allowed to take cash from me without a hand slap from the insurance companies. That's a really interesting point. So other ways that our health system is messed up. I go to Satellite Med in Cookeville, Tennessee, because they take private insurance only, no government insurance at all. And they have a sign that says, if you are on government insurance, we cannot treat you. we're not even allowed to let you pay cash to get a strep test or something, because they are required to bill the insurance, the government insurance, and not take your cash at the rate the government insurance does, which is a higher rate. And if you have a deductible, you are now paying that higher rate, right? Well, because they don't take government insurance, they can't see you at all, because it is now it's considered fraud to pay cash if you have insurance. And that is just one of the many dysfunctional things that's happening. It's one of the many ways that systematically and culturally the medical system is it's increasing the bureaucracy and making you the product instead of the customer, because it makes their life better when their customer is the health insurance company and not you, or when their customer is your employer who's paying your health insurance for you and not you. Because think about that. You've also been cut out of being the customer of your health insurance because your employer is paying for it in many cases. It's become the cultural norm that your employer provides health insurance, and then the health insurance company doesn't have to make you happy. They have to make your employer happy, which is some balance of all of my employees don't die, but also we don't cost too much money. That's what it is. That's the incentives of the system. As my friend Jack Spirko would say, I'm hearing him in my head right now, the purpose of the system is what it does. So if we talk about problems in the U.S. healthcare system, there are many. I'm not going to hit them all today. You can put some in the comments too. Just remember, it's comment all caps so I see it. Margot's doing a very good job of making herself visible when she says stuff today. The first problem with the U.S. healthcare system is this: being sick and dying sucks. And sometimes they have no idea what to do. Many times they have no idea what to do. In fact, a lot of times your doctors and your healthcare professionals are making their best guess at what's wrong with you and doing one course of treatment to see if that's what works. That's reality. And if you look at how herbal medicine works, if I have a cough, we're going to try mullein for the cough, right? And then if that doesn't work, we're going to try something else. So it's not like that hasn't been part of the process the whole time for helping to care for people. Now, there are times when we know a thing is wrong and we know what the cure for the thing is, right? And a lot of times, guys, for like common ailments, the cure is time and rest and nutrition. And sometimes they can give you something to ease the pain, or sometimes with antibiotics, it can make you overcome the thing that's making you sick. You know, the advent of antibiotics has made a huge difference in longevity. And you can't, as much as I hate taking antibiotics, that is a reality that I also accept, right? Would I rather never have to take antibiotics? Sure. But if I really, 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 really need them, will I take them? Yes. That makes me different than some of my other friends who are completely down the road on alternative medicine. And I don't begrudge them that choice. I see it as a choice. I support them making the choice. Margot says, I have had so many doctors guess, and I'm so fed up with all of them, and that sucks that I don't have anywhere to go to get help with something that 10 doctors can't fix. Yeah, a lot of times when you have an autoimmune disorder, I was reading a statistic the other day, it's like 5 to 8 years and 20 doctors, and they finally figure out it's like, oh, you have lichen sclerosis or whatever it is. I have PCOS too. I don't have a PCOS diagnosis. I have a PCOS guess, and I respond to things that make it better. So do I have it? I don't know. I have all of the things that show you, except for one symptom. And that's because my pain receptors are different than other people's. Also a problem at the dentist, that pain thing. So chronic illness is on the rise alongside obesity and the way our food system has changed. And there are more people needing help because of it. Like more people younger have problems like big cancer problems, diabetes, heart conditions, all of these things that require some meds to keep you alive. And if you look at how obesity has changed in this country, they're like, nah, the lines go up together. And then we have a culture where obesity is not something that somebody like, there's a lot of positive ways to deal with that, right? Instead, there's, it's shameful to discuss it in a lot of circles, not our circle. It's shameful to discuss it. And when you start making changes, other people tear you down and say that's not going to work. Like, you go tell somebody, I'm going to go do the carnivore challenge because I want to feel better. Or any other whole foods based diet like Whole30, getting rid of toxins in your life, any of the things you might do. I'm going to go join a gym and start working out. And they'll tell you all the reasons you might fail. And then when you start doing well, they'll be jealous and tear you down. If you have anybody in your life like that, guys, your first move towards becoming more free is get rid of those people. Get rid of those people. That's just what has to happen. With chronic illness on the rise and more people needing care, though, that's taxing the system. And then there's also this thing where, as a doctor, if you're making educated guesses and 99 out of 100 of your patients are basically on the corn syrup gravy train, and one comes in who isn't, who has similar symptoms, and they say that they're not, you don't believe them. And I would understand why. Like, it's understandable because the sick people are getting sicker. I just heard yesterday that they've changed the definition of pre-diabetic to have your A1C even higher than it used to be. And elevated A1C is not what you want in your life. We already had a doctor-patient ratio problem coming before everybody got sicker, right? Because the boomers are retiring, they're also getting sick, and there are a lot of them, and there aren't enough replacements to care for the boomers, and now we're adding other generations to the mix, and it's a cluster. It's totally a cluster. So we made this worse during the pandemic by making work environments so dysfunctional for doctors and nurses that many left permanently. Some left the system permanently and started alternative concepts, which we'll talk about some of those at the end. But also some just left and were like, I'm going to drive Uber because I make more money and I'm happier, right? Or, maybe it wasn't driving Uber, but they found other things that were more fulfilling than the toxic environment that they were working in. And I have a lot of sympathy for that. David wants to know why Nicole hates boomers. I don't hate boomers. There's just a lot of them. Another problem is that codes and billing have made the system worse over time, leading to an increased bureaucracy. It created incentives to bill for every eyelash twitch, which means it behooves you as a clinic owner to have somebody follow you around with a computer, writing everything down. That person has to be paid. It's making them enough money to pay that person a decent salary to have learned how to code, to do the codes, and to maximize the amount of money that they get reimbursed from Medicaid, Medicare, and health insurance. And they all use the codes. Like, they use the same coding system. Like, they define the codes. I believe Medicaid, I don't know if it's Medicaid or Medicare, comes out with like, this is what this condition should be reimbursed at. It's kind of like a mechanic says, it's a manual that says an engine replacement costs this much, and that's how much you bill for, no matter how many hours it takes. Well, that's become so complex, and it becomes more complex every time I look at it. And it's been accepted as the only, it's as if it's only way we could ever charge for medical services, right? And the sad thing is, when Medicaid was put in place to help people without enough money get the care they needed, and the whole coding system was set up, like, the idea was to help poor people get access to care that they couldn't afford by having parameters. The intention was, hey, let's help poor people. The outcome has been an ever increasing amount of cost on healthcare and more bureaucracy and all of these things. So that is a big problem, and the bureaucracy has made it even worse. Margot says there are also multiple codes for the same procedure based on what kind of coverage a person has. Yep. And it can be also changed by how many prescription medicines you're already on. And so it's better for the provider to have you on more long-term prescriptions because they can bill more money. Like, we set up an incentive that makes dysfunctional care functional for the providers that provide it, right? And with that, the purpose of the system is what it does. Of course, we've ended up with attempts at managed healthcare. Like the advent in the 90s of managed healthcare was my first experience from having that family doctor who you went through to, and they kind of knew who you were over time, and they knew what your weaknesses were, and they were like, this is the lifestyle thing. It's like they were a coach. This is, you need to learn how to deal with stress better. You need to change your nutrition. You need to get better sleep. You need to exercise on the regular. Like they were more of a health coach who also had the power to write prescriptions or tell you needed to get your tonsils out or whatever. And that kind of care basically didn't completely disappear, but it certainly was very hard to find by the end of the 90s, where you would end up in a giant, like, I don't know, were they called HMOs? I'm thinking HMO, Healthcare Management Organization is probably what that stands for. You go in and you had to see your primary care physician, and they're like, yep, you're sick. You need to go to a specialist. And then you'd wait 3 weeks to go to the specialist. And it'd be like, yep, you're sick. I don't know. You need to go to this other specialist. And you wait 3 weeks to go to that other specialist. And all of the time, the bills are racking up against your insurance. But then your insurance isn't covering all the bills. So you're getting bills and you're still sick, right? So you end up having that whole blah, right? That was like a small example of how it was going to end up the way it is today, where codes and billing have made it just worse and worse and worse over time, more bureaucracy and more places that don't know how to take simple payment for service. A simple like, hey, my arm's broken, pretty sure I need a cast and I need it set right. Maybe we ought to look at that, see if I need some more deeper surgery. And then you go through and get all of that done. And then you go to rehab to get your muscles back. It's not a fun situation, but literally we know how to deal with that. Like that's not a complex health problem. It's a bone that's broken that may need some more attention than I hope if it's not a clean break. But, you know, you don't need to just leave me in there, you know, with my arm broken, waiting for us to figure out how you're going to get paid for that. Right. Health insurance as a tax deduction was incentivized in the 40s. And that messed with, and in the 50s, it was like changed up a little bit, but that has led from that transition for payment for service. And then if something bad happened, you had insurance come in to deal with like a big cancer incident or something, to being sick and dying, still sucking, but now your employer is paying for the health insurance. And what happened with the tax deduction is I believe it started out for everybody could have like a pre-tax benefit for getting health insurance. Like the IRS is pushing people in to get health insurance. Again, the motivation being then everybody gets care, right? If they have health insurance. Well, except for then employers started taking that over as a benefit, so they didn't have to pay you more, so you weren't in a higher tax bracket, which made sense because then you don't pay a higher percentage of your income out in taxes. And then your employer was the customer and not you. The market incentive is all wrong there. It's all wrong. One of the things I liked about the German system when I lived in Germany was that your private insurance that you paid for followed you no matter where you worked. Now, I have other critiques of the German healthcare system, but that part made sense. Here, it's like I can't leave my job because I'm going to lose my health insurance and I can't get other health insurance. And now I'm screwed. In Germany, they have two systems. They have the government system where you get a base layer of care. And then if you can afford the more private insurance system, you get better care. And that system's basically here too, by the way. If you look at how the insurance is organized here, we have something very similar here. It just is implemented with a lot more fascist payoffs so that it's even more abusive to the people. We also had a pretty big cultural shift, right? Healthcare and medical support became an elite system that cut out alternative healing, health coaching, and prevention-focused care as anything that's worth covering under health insurance, which then your health insurance became your health care. So one of the big shifts we've made is that health insurance equals health care in a lot of people's minds, and it's not the same thing. the care you get is one thing, and the insurance is how it's paid for. And the insurance is set up so, the doctors don't have to worry about that, and they can focus on making you better, except for then their hands are tied because the insurance will only allow these interventions. And that's like telling the teacher what to teach. If they're a good teacher, they should know how to set up a curriculum for their students, right? We're in the way when we do that. And one of the things that's made medical breakthroughs happen faster in our country is that our system has multiple tiers. If you are rich and you are sick, you can get care. You can get really good care, right? It doesn't matter what your insurance is. If you can pay $5 million for the latest thing, they'll go for it. And that means that there is still a profit incentive for certain breakthroughs. Rich, sick people really help innovation. They really help innovation. And if you are in a system where no matter who you are, you get exactly the same care, those innovations get cut off. That is a statistical thing that happens. So I don't think there is one perfect solution, but I think that what we have is driving us towards what they're going to call single payer, which will be worse than any other socialized medicine system in any other country in the industrialized world. Because what we're going to do is take a broken system that we built on with more breaking, which we built on a third time with more breaking, and then we're going to build on that and make it quote unquote single payer with even more payoffs and insider deals and public-private partnerships, which is the long way of saying fascism, right? So Margot says, if more people took their own health care more seriously, the health insurance and our food systems could be better. Margot's already going towards solutions. So what does this mean for freedom? Because that's why I wanted to talk about this. I think that if you are a parent and you have children and you fall on hard times and you believe in property rights and you believe in freedom and you believe stealing's bad and your children don't have enough to eat and your only option that you can see is to steal food for your children to survive, I believe it's human nature that you will steal the food if you can. You will do anything you can to keep your child alive. You will do anything you can to keep yourself alive. People may say they wouldn't, but until you've been in that situation, you don't know if you will or won't. And I think it's very unrealistic to think that a whole bunch of people would just starve to death rather than try to steal a loaf of bread. Which means for freedom to happen, for freedom to be a reality, for us to be in a truly liberated society, there needs to be a certain amount of things that people have for stability in their life, food and water being one of them. And I think when somebody's very sick and dying, it's a horrible thing. And I think when somebody's sick with something that can be improved or cured, and they're cut off from being able to do it because of insurance, bureaucracy, whatever it is, access or money, that they are now in the same situation as the parent with the child that's starving. Dying for a different reason is still dying. And so then they're going to be willing to do anything they can to get that to happen. And right now, the solutions that are being furthered are solutions that make the system worse with government intervention. They don't see any other way that this could possibly be better privately, that we could possibly make a world where healthcare is, and people who are sick are connected, where it becomes a place where the incentives are returned to where you, the sick person, are the customer instead of an insurance company or your employer or both. And we blame a lot, right? A lot of what's standing in our way to making a system that works, a couple of things. One, everything that's come before now and accepting that that's just the way it should be, like learning how to read, you have to do phonics. That's the only way. It's not the only way. There might be a better way out there. I don't know. I'm not a reading teacher, but there might be a better way out there, or there might be a better way for somebody. But if we only say phonics all the time and that's all we ever do, we'll never know, right? But we're busy blaming. Like, people were so excited that health insurance executive got shot and killed because he was overseeing a company that was killing people. I understand that instinct because I know how frustrating it is when you need something to have it denied. I am under no illusions. If I get very, very sick, it's going to be very hard for me to get care. So I do everything I can to not need care, right? But are the insurance companies to blame? Partially. The insurance companies have participated in a system where they make money by not covering stuff. They take advantage of that bureaucracy that we talked about to make more money, and they set up incentives where there's some payoff. I remember starkly the time my partner needed an MRI. No, it's a CT scan. Didn't have insurance. This is before all of the insurance things that happened when Obamacare came in place. I think it was 2012, 2013, somewhere around there. And he paid $500 for a CT scan. Got it, went on with life. Well, he then also got onto an insurance policy because he had some conditions and it made sense. And 2 years later, when he needed a CT scan, it cost $1,600 out of pocket because his deductible was $5,000 for the same $500 CT scan. $1,600 because that was the negotiated rate of the insurance. And I'm like, tell me honestly. So like you bill them, they say we owe you $1,600. How much are you giving to them of that $1,600 if a CT scan costs $500? And they're like, they gave me some baloney about how, well, we charge cash patients less and we lose money on that. And I'm like, why would you do that? That's not a good way to run business, right? It's not a good way to run business. And I don't believe you. I don't believe you that a CT scan needs to cost $1,600. Maybe it does now. I don't know. But back then, no way. No way. Because the way that cash clinics work, that kind of a procedure won't cost $1,600. And that's a pretty good feedback loop. By the way, Surgery Center of Oklahoma is a really good place to go find out what things should cost by looking at their published rates. Imagine if all of the healthcare providers had to publish their rates. Imagine what that would do, right? And you know who else is to blame? The nonprofit hospitals who go out and raise a bunch of money to keep costs down for people where it costs more to get procedures than the surgery center in Oklahoma, for example, because they have so much overhead. And they too have figured out how to maximize the coding system. They too, some of them have figured out how to trash people's credit and lives who were sick, who owe them money. Managed healthcare systems, terrible. The IRS, all of them are to blame. And guys, as much as I love doctors and nurses who dedicate themselves to keeping people healthy, doctors and nurses who have let this happen, and anybody else in the healthcare profession who have allowed this to happen, they can see the dysfunction. You want to have an interesting conversation, play this podcast for somebody in the health business. They'll probably disagree with some of the things I say. That's fine. They're going to come up with a whole bunch of other reasons the system's broken that I would love to hear, right? This is just my observation from years of interacting with the health system and years of interacting in the health policy world at my former job. There's a lot of dysfunction. And some systems that were functional that have become dysfunctional now gave us models for what could work. Like back in the day when I was buying health insurance, they'd be like, hey, do you want dental insurance? I'm like, how much is it? And they'd say $100 a month. What does it cover? 2 cleanings a year, and we'll cover up to $100 in whatever, cavities or whatever. And I'm like, wait, so I'm going to pay $1,200 for 2 cleanings and $100 cavity towards my cavities. But if I just pay the dentist, it's $80 per cleaning, and a cavity is about $250. That math doesn't work for me. No, I don't need dental. And at that time, you could just pay the dentist. Well, what's happened over time is the dentists are like, you go in there like, who's your dental insurance? And I'm like, don't have any. And their faces fall. And they have the whole system set up, just like the medical doctors now, with ways to code you to death on every little thing that's been done. And this is how much it costs. They're becoming managed dental systems. It's terrible. It's dental as a whole experience is frustrating anyway, because your teeth are really like not where you want to have pain. But also that has made it worse. Well, okay. So then I was like, well, it's really interesting. When my dog is sick, I can take my dog to the vet, and my vet looks at my dog and says, she has liver cancer. I can tell by looking at her. He doesn't say that, right? But he did say she either has liver cancer or hepatitis based on blood and how she looks and the symptoms. And there are two ways for me to diagnose this officially. One is we put her on hepatitis treatment, and if she responds, that's what it was. And if she doesn't, it's liver cancer. And I'm like, okay, then what do we do? And he's like, well, we can biopsy the liver, but she's really sick. And while there are, like you can put your dog on chemo and all sorts of stuff, it's just going to make her quality of life worse. So, like managing the symptoms until you can't anymore is what I would recommend. If the hepatitis treatment doesn't work, the hepatitis treatment isn't going to make the liver cancer worse, but it's worth the $50 right now to hope that that's what it is. And I looked at him and I was like, but is it hepatitis or is it liver cancer? And he's like, I've seen a really big rise in liver cancer in dogs. Okay. That's the kind of advice I want from my doctor. I want to know what it is, what they think it is, what they're doing to troubleshoot it. And I don't actually mind knowing that I'm taking a treatment for hepatitis when they're like, well, it's invasive to test you for the other thing, so we're testing you for that. Because then you can say like, well, test me for the other thing. Then you're involved in your care. It's like a whole different thing. I remember this summer when I was super sick in August, I went to Satellite Med, and the person that they put me with happened to be the founder of Satellite Med. He's a really good doctor, guys. He was like, okay, so this is what I'm going to do. This is how it's going to work. This is what I'm going to look for. And this is every step you need to know. Okay, go. We did it. And he's like, okay, from here, what we need to do, because I've now seen the problem, from here, what we need to do is take these tests. And here's how you take these tests. And then once that's done, I can prescribe treatment. I am hesitant to give you anything for this until I know, because if it's this, then antibiotics are the best answer. And if it's that, then they're not. And this other thing is, but if I give you antibiotics and you have this other thing, it could kill you. And I don't want to kill you for something stupid, right? I was like, where have you been all my life? Like it took 3 minutes, maybe 2 minutes for him to explain that. And then he was actually trying to make me well. And then he said, he gave me a form, lifestyle stuff. Like, these are all of the things to get better, just general lifestyle things I'd like to see you do. On that list was no wheat. It was an intestinal problem. But on that list was no wheat. He was like, this is what you need to do for your diet. Here's how you get probiotics, like all of these things. And drink lots of water. It was like basic stuff you should already know. But back in the day, doctors would coach you on how to be more hygienic or how to stay healthier. And that's exactly what he did. It was like an old-timey thing. So I lay out that problem and say, there is hope. There are models where it's worth. I think the first thing we need to do is make it so that your patient is your customer, right? And, Goldshaw Farm here is saying most of the industrialized world moved to some sort of universal healthcare system post World War II. And the US didn't, basically. When we're talking about solutions, as much as I am biased towards the free market freedom solution, I'm willing to look at that. I'm willing to look at what countries have had a more of a socialized healthcare system and how has that worked. Because I know from experience in Germany, the way that worked is there's sort of a two-tiered system. And I know here we have, like, if you're really rich, you can get care. We have like this middle section of private health insurance where you get better care than if you're on Obamacare government insurance, and you get a little bit better care than if you aren't on any insurance at all, or if you end up on Medicaid, right? And we have multiple tiers. We don't have two tiers. We have tiers and tiers and tiers and tiers. But things that give me hope are cash clinics like Satellite Med, which is not only, it's a cash clinic, but also takes private insurance. Concierge care, where you're subscribing to your primary care physician, right? There's a growing body of knowledge and research on how lifestyle and nutrition impact our bodies, which is much to the chagrin of big pharma and big food. If you eat clean and you get exercise, you have a better chance of a better outcome. Functional medicine wasn't even a thing that was all that popular 20 years ago. Like, the difference in functional medicine now, where they're looking at the whole picture. Like, imagine this. You look at the whole picture and then you like decide what to do, right? Woo! Private membership associations that link people to alternative ways of getting care, very cool. Or doctors who have opted out of the system who are only doing PMAs. They have ministries that do that as well. Integrated manual therapy, which is a physical therapy thing. And doctors, this is the big one, doctors and nurses who are fed up from inside the system, who do the best they can to help you get real care. Some of them have stayed in the system. Some of them have left the system. They are talking to each other. They understand it's a problem too. Those are the people with the medical training who can really help you out, right? But this really impacts your freedom, because if you get very sick, it's hard to be like, live free and die, because you're dying. Yeah, you know what I mean? And so I think it's important that we continue to talk about solutions. And I think the only way we fix it as a community is to talk about it openly and to admit that we don't know. The one solution everybody wants to push, and everybody's one solution is different, whether it be single payer, whether it be privatized, whether it be, private membership associations, whether it be cash clinics, whatever it is, it's always one solution. And health care is a complex problem that requires different solutions for different people. So I think having a better marketplace of options and choices can get us to a much better outcome, and not just shuffling everybody into one choice, right? But the only way to fix this is to invest your time, money, and energy in alternative ways to get care. Become the solution. If there is concierge medicine or a membership-based primary care doctor in your area, like that guy in Knoxville who's on my show, and that's reasonable for you, like, go pay him money above your health insurance to get that care and see what the difference like, and support what he's doing. And yes, if there is a fence post sticking out of my leg, I'm probably going to end up in the system that I don't want to be in, because I'm going to have to go to a hospital. And I don't know of any hospital solutions yet. If you do, please let me know. But, the hospital that's near me is the hospital I end up at in that situation. And usually they're pretty good at dealing with fence posts through the leg. It's some of this other foogly stuff that's happening because of choices we've made, where we have triggered parts of our DNA to give us autoimmune system disorders by believing the officials that tell us what's healthy is healthy when it's really not healthy, right? That's some of this is of our own making, and you can't just shy away from that. You cannot shy away from it at all. But we also have things like health shares. So I'm in a health share ministry and I pay money every month. And if I get sick, my illness would be shared by them in many cases, not all. And it's not health insurance. So if I go, if I were to get diabetes and needed to go on insulin, they'd pay for the first 6 months of my prescription. And then after that, I'm required to have figured out how to pay for that. Their purpose is to help for the unplannable stuff rather than the ongoing maintenance stuff. Kind of like your car insurance pays for the auto crash, not for your tires or your oil changes. That doesn't happen. So those are something to look into, especially if you are doing the entrepreneurial thing and starting your new life. Relationships and kindness. I find that having good relationships with the people who I expect to give me care rather than screaming at them does a little bit better. Now, likewise, setting boundaries when people are pushing things is important. And the easiest boundary to set is to leave if you can. But having an advocate there if you're very sick is very important in our system at this point. I don't want to just leave somebody at the hospital unattended, because who knows what's going to happen from there. They're not at their best, and your advocate can see more than you can when you're that sick, right? But relationships and kindness, it doesn't mean you go in expecting that everybody's a jerk trying to screw you over. You go in and you learn what you can learn. We had a very good experience with my stepdad dying last year with the hospice. The hospice people were great, and they knew so much. I wish I had that for my cat. I need a hospice advisor for my cat who's not in pain at this time that I can tell, but he's clearly slowing down. And I don't want to be taking him to the vet every other week getting blood work. It's just like, because that's just like a needle every other week. And needles are big in those little legs. Like, I don't want to do that. Right. Obamacare plans and employer insurance are options if you are self-employed. Well, not employer insurance, but well, if you are the employee. So when you start your company, you can become the employee and buy insurance that way. And you can get access to private insurance that way if that's part of the nut you need to crack. But a lot of people go for those subsidized plans. And if you do really well in business your first year, you may end up having to pay a whole lot more if it's subsidized, because there are subsidized plans. Like, I always get advertisements, $25 a month, you can get health insurance. And I'm like, yeah, until I like bill out a couple $100,000 and then I owe a whole bunch more money than I'd ever pay for health insurance by just paying for health insurance. Yeah. This person says 47 years, no oil. Oil makes everything. Okay. I don't know what that means. So that's not a very clear comment. But I would say seed oils are part of our nutrition issue. We should do a whole Freedom show on taking control of your nutrition, because that's a big deal. Private insurance is awesome if you can afford it. It's also not cheap. Like, we had private insurance for my stepdad when he was dying, and that made a big difference over what government insurance would have provided at that time. And for us, it wasn't, are they paying for this, so much as how can we get reasonable advice? How can we know all of our options so that we can make this person comfortable, right? But with all of those instruments that you have now, and you also have like temporary emergency insurance, which some people are just keeping all the time. That's a high deductible, but it kicks in if you get sick. That's what people are doing to establish a baseline to walk away from the job farm and start doing their own thing. If you're really healthy, it's easier to take risks with like, I'm probably not going to get sick. If you're young and healthy, it's easier to take those risks. Like, you got to weigh the risk. But all of it means taking ownership for your health and your health care. Just like you need to take ownership for your money and your wealth. Just like you need to take ownership for anything that is in your life that you want to have be better. Because really, as we walk towards freedom, it's about making the choices to build the life that we choose without worrying about the barriers that are there. And when we come up against a barrier, like in the health business, right? Like the whole corporate health system that is the US, like, obviously the easiest thing or the best thing is don't need it. If you don't need it, you're better. So that's nutrition, exercise, all of those things. But if you do need it, what's sort of like your way out? Well, one way out is a health share. Another way out is to have so much money you can just pay for it. So if you do really well on the wealth side, then you're less worried about the, insurance side. And if something does happen, knowing what your options are to pay for it is also important. And having relationships with people who can help you is so important. That's why the life of freedom is more work than people realize, right? Because all of those stories I told you about negotiating rates, I had to do that. I couldn't outsource that. Would I love to outsource that to somebody? Absolutely. As I said, I don't love bartering. I don't love bartering. And the purpose of the system is what it does. And what our system is doing right now is marching towards a complete meltdown so that we can replace it with single payer, which they're going to like promote as the best thing. And then you're going to discover that single payer works a lot like the VA, where you don't get care for the things you need and the treatments you need are not covered. But we will preserve in our country a private system as well. And like, that's just the pattern I see. I don't think there's any way around that. So be ready for it and have already figured out what you're willing to do to participate in the private system. And if you have a private membership association around you, which they are starting to really spring up, look at those. Because at the end of the day, what's important is, how do we get people access to good health care? How do we get people good access to information about their health? And how do we support each other as we move forward? Because at the end of the day, I don't want to build on a bad system. I want to find a better system. That's what I want to do. Anyway, if you like the show and want to support the work I'm doing here, you can do it in a couple ways. One, get your coffee at Hollow Roast, which is hollerroast.com. To consider jumping into our membership, we have a solar workshop webinar happening on Sunday at 3 p.m. Just head over to livingfreeintennessee.com to find out more. And I hope you enjoyed this episode of the Living Free podcast. With that, guys, go out, make it a great week.